Hi everyone, Don Wood from Heart Coach for Life, and today I want to talk to you about my hero's journey. It began several years ago where I was a senior account executive with Bell South, and I would help in my role to help engineers from Bell South to get on the same page of music with our clients for big pipes out to the internet. It was a very rewarding career for me, both intellectually and financially. And yet something was missing. And I discovered that I really wanted to pursue my passion for athletic training. So I left my corporate job and I got involved with athletic training. And in addition to the athletic training for people, I formed small men's groups. I would keep the groups at 5 guys. The emphasis was on leadership training, both in their families and their careers. And what was happening in the men's groups is invariably one of the guys would pull me aside and say, can we work one-on-one? And it began a whole new journey for me in the coaching business. So for the next 10 years, I was getting involved with having clients in coaching and my own development in coaching and having my own coach, which was a big leap for me. I always used to think that I could do it on my own, but the real turning point for me was getting my own coach. And then what was happening for me anyway was I was getting bored with the leadership training, and I knew that there was something else was missing. And then a miracle happened. About a year and a half ago, I was sitting at my desk and I had some lower back pain on my right side. And before I knew it, 10 minutes later, I was on the floor screaming in agony. I was in excruciating pain. I went to the emergency room. They sedated me, they tested me, and then they made the decision to admit me overnight. The next morning, a surgeon came into my room and he explained that I had kidney stones in my right side, my right kidney, and the irony was that my left kidney was even in worse shape. He said, you have a whole rock wall of stones in your left kidney, so much so, Don, that it's barely functioning. So what we're going to have to do here is have a series of surgeries to correct the problem. So over the next 3 months, I had 3 surgeries, and a couple of interesting things happened to me through this time period. Number one, my beloved dog had died unexpectedly of a rare infection. And number two, in the surgeries themselves, my blood pressure was sky high and they couldn't understand what was happening to me. And so what I decided to do is go visit my cardiologist, because I had had stent placement surgery back in 2002. So I'd been a client of my cardiologist for 15 years. I have a very good relationship with him. And so what we decided to do is to have me conduct a nuclear stress test. Normally I do very, very well on these tests, but this particular day I bombed the test. And before I knew it, the next morning I was in Boston on the table having open heart triple bypass surgery. I never had seen this coming. They said that 3 of my arteries that surrounded my heart were almost 90% blocked, and that I was literally a walking time bomb. So if you think about it, having the surgeries for the kidney stones that revealed the high blood pressure was a miracle for me. Now, what happened after the open heart surgery was I was having difficulty a day or 2 after the surgery restoring my normal breathing, and they were really giving me a hard time that I had to work very hard at restoring my lung capacity. Another thing that's interesting is that when you have open heart surgery, when you're on the table, you're clinically dead. The only thing that's keeping you alive is the heart-lung machine. And after the surgery, when they bring you back to your normal heart rhythm, because your heart was in the rhythm of a heart machine, different than what your heart is, it can take the brain up to a year to recalibrate back to your normal rhythm. And as a result, you can experience a lot of emotional mood swings, which is what was happening to me. I remember coming home from the hospital a week later. I was alone upstairs in my bed. My dog wasn't there to offer any companionship because she had died 30 days before the surgery. It was mid-November in Boston, getting dark early, and there I was, one-on-one, alone, sitting upright 24/7, because when your sternum is sawed open, it's very painful to lay flat. So for about 2 or 3 months, I had to literally sit upright 24 hours a day. Now, here's another interesting thing. When I was able to drive about 2 or 3 months later, I had another visit with my urologist as a follow-up for the original surgeries for the kidney stones. And he said, we've done a sonogram, Don, and the stones have returned. And what we're going to have to do is go in and have a series of surgeries to remove those stones once again and figure out what the heck is going on with you. Well, from the time where he had made the diagnosis to about 2 weeks later when the surgeries were scheduled, I began having a very high fever. And I initially thought it was just the flu, but after about 3-4 days, I went to see my doctor. They did a blood test and they immediately rushed me to the hospital because now what had happened is the stones had blocked off my kidneys. The fluid was backing up into my kidneys and I was experiencing what is known as septic shock, and there was sepsis in my bloodstream. They explained to me that I had to immediately go into surgery to drain my kidneys. So I went in at 11 o'clock at night under emergency surgery. They were able to drain my left kidney successfully, but they couldn't get my right kidney to drain. So immediately after the surgery at 4 o'clock in the morning, they put me in the ambulance and I went up to Boston for a nephrostomy procedure the next day. And that's where they drill a tube in your back to drain the kidney, and I had a bag hanging down for the rest of the summer to see if we could get the right kidney functioning once again. They determined that after 3 months that the kidney was never going to regain total functionality again, so I had an option. He said, you can keep the kidney at 10% functionality, but you're going to have the tube and the bag remain, or we can remove the kidney and the tube and the bag will go. And I looked at him and I said, well, what do you think? So I had my right kidney removed. And then what I discovered is that with the recovery from the removal of my kidney was almost as difficult as the recovery from my open heart surgery. It took me a few months just to get back to full strength again. I went back to the gym and I was slowly regaining not only my cardiovascular health, but my muscular health. And then about 2 weeks before Thanksgiving this year, I was walking on the treadmill and all of a sudden my heart just felt like it was on fire. The whole bottom row of my teeth just ached and my throat was really just stuck up and I felt like I couldn't breathe. So I went and I decided to sit down and rest for a few minutes. And then I did something that was really smart. Instead of calling 911, I decided to take a drive to the hospital. When they get there, or when I got there, I should say, when they were looking at me and they did my pulse and my blood pressure and a quick EKG, and then they finally said, Don, why don't you get in the wheelchair here? And they wheeled me around the bend, and before I knew it, there were 9 people waiting around this bed for me. And I got onto the bed and they were all doing their own thing, working like crazy to do different things with me to get me prepared for what I realized was surgery. The surgeon walked up to me and said, you're experiencing a heart attack and we're going to get you into surgery immediately. We're stabilizing you, but you need to go into surgery immediately. That scared the living daylights out of me because I was feeling these symptoms. I literally didn't think I was going to make it. I was crying. And it was this fear that I wasn't going to be able to say goodbye to anybody. Well, I made it through the surgery. About a week later, I met with my cardiologist and he said, Don, you had open heart surgery just a year ago and now you had blockage and another heart attack. And he said, he says, this never happened. So I was trying to think about your case. And he says, then it occurred to me, You've had 10 surgeries over the past year. Your body has been under so much stress that you've had elevated levels of cortisol in your bloodstream that have been sustained that create plaque buildup, and that's what caused the heart attack. Now, he said the good news is this. If you're going to have a heart attack, you had it in the right place. You had it in the rear artery. And from the time of the event till the time of the surgery was only 2 hours. So there's either minimal or no damage. So here I am, 9 weeks later, and I'm getting back into the swing of things again. I've restored my cardiovascular training. I've just gotten back into weight training. And what I have decided to do is now take my coaching practice into a whole new direction. And my tagline is, I help men to come back after a heart attack. I have a whole system of spiritual, relational, emotional, and physical transformation after you've had a heart attack. And I'm here to help people. I have a real passion for it. I certainly have some experience with it, not only in the coaching area, but also in the physical training area, and certainly walking through the steps of the many challenges that I've faced over the last 16 months through the various surgeries. I am really excited for what's ahead in my journey to a whole new world of coaching, and I can't wait to get started.